7:33, and new rules that go into effect today could impact 100,000 Americans waiting for a kidney transplant.
The new guidelines tweak how the waiting list for deceased donor kidneys is structured, giving certain patients priority.
The Fox Medical team's Beth Galvin has witnessed dozens of transplants and joins us now to talk about these new rules. And Beth, good morning to you.
And good morning, Buck, and good morning, Gavir. You know, if you're one of the people who is now on that list and you're waiting for a kidney, we don't think that you're going to really experience any major changes. But these new rules could be good news for younger, healthier patients and people who are currently on dialysis. And Eli Porter has been there for 10 years and counting. This is Eli Porter's life. Every Monday, Wednesday, and Friday, the 28-year-old spends 3 hours hooked up to a dialysis machine, filtering waste from his blood.
It is a way of life. It's tiresome some days.
Porter has been on the United Network for Organ Sharing's kidney waiting list for 2 years now, on dialysis for 10. But under new matching rules effective this week, he could move way up that wait list.
I can get a kidney anytime, any day now. So
under the old system, Emory kidney transplant surgeon Dr. Nicole Turgeon says the main deciding factor was how long you'd been waitlisted. Dialysis didn't really count.
One of the major differences is that now you will be given credit for your dialysis time in addition to your waiting time. So that will be added on to the time you've been on the waiting list.
So if you started dialysis before you were listed, your wait time will be adjusted to the day you began dialysis, which means that Eli will get credit not for 2 years, but 10.
It is big news for them. It's really going to help them in terms of getting better access to the transplants and getting a transplant sooner.
Under the new kidney allocation rules, every candidate will be assigned an individual score based on how long they're likely to need the kidney after their transplant. The top functioning 20% of kidneys will go to those likely to live the longest. Dr. Turgeon says hard to match patients will also get priority over the small pool of kidneys that their bodies are less likely to reject.
I think the important point is that all candidates are going to maintain their access to transplantation. We are just going to help enhance some of the difficulties that we've had in the past in terms of patients who are hard to match, who really didn't get access, are now going to get access. And patients who were on dialysis for long periods of time are going to get credit for that now.
And both adults and children on dialysis will be able to adjust their wait time to their dialysis start date. And as I mentioned, the post-transplant scoring system also starts today. It's going to be based on 4 factors: your age, your time on dialysis, your diabetes status, and whether you've had a previous organ transplant. And the lower the score that you're given, the higher you could go up on the list. Buck and Gavir. So, you know, certain patients in certain categories could move down the list, some could move up the list.
So you talked about who could move up the list, who could be moved down the list.
Well, I think, you know, the patients who may have a harder time now or a longer wait are going to be the older patients and the patients who are sort of less healthy, who will not benefit, you know, or face the longest benefit from getting a transplant. So they may have to wait a little bit longer, unfortunately.
All right. Beth, thank you.